Namaste, myself Dr. Belaku. I have been associated with Indus Valley Ayurveda Center since 2011 and I enjoy my practice. So I believe Ayurveda is a very complete life science. It's not just the treatments. So Ayurveda should be considered as like a part of everyday routine. So it's not like going to a place getting treated with Ayurveda system of medicine. We should imbibe the principles of Ayurveda in our lifestyle, wherein this is very well described in our classics in the name of Dinacharya. And this Dinacharya has to be as per the seasons, which is called as Ritucharya. So having a proper Dinacharya in accordance with the season helps in maintaining the positive health. So this is the beauty of the Ayurveda. So Panchakarma is a very unique, very precise, very elaborate treatments that is considered in Ayurveda. So basically we have two lines of treatment. One is Shamana, which is palliative treatment, and the other is Shodhana, which is the Panchakarmas. So these Shodhana therapies are something wherein we expel the excess doshas out of the body. And as the word says Panchakarma, they are the 5 procedures. So these 5 procedures are induced into the system to have the elimination of the increased doshas from the body. So they are done for a healthy person to prevent illness, to promote the positive health, and it's more like a wellness treatment. And in a diseased person, it is done as a curative part. So when it comes to preventive Panchakarma, we call it as Ritu Panchakarma, wherein there are specific seasons wherein we do specific Panchakarmas because we consider ourselves to be the microcosm of the universe. So whatever changes happen in the universe, we are getting affected with it. So considering the Ritu or the seasons. So for example, now we are towards the end of the summer and we are heading towards the rainy season. So we are in the juncture of the summer tapering off and getting into the rainy season. It is the Grishma Ritu and the Varsha Ritu juncture. So here we believe that the Vata starts getting provoked during the Varsha Ritu. So Bastis becomes the priority of the Panchakarma treatments for the healthier person. And again, post-raining season, because there is predominance of Pitta, Virechana is advised or the bloodletting is advised. Similarly, when it comes to the spring, the Kapha is predominant and Vamana is advised. So this is about the seasonal Panchakarmas. And when we consider the Panchakarma for the illness, it is as per the constitution of the person, as per the health needs of the person, depending on what the strength of the person is, what the strength of the disease is. And again, we to a certain small extent consider the present lifetime also. And this is like a very elaborate treatment, as I said. So it has to be done with very detailed consultation, follow-up, and post-follow-up Panchakarma is very, very important. When the Panchakarma is done in a very organized way with the right preparation, then the right post-Panchakarma treatments, the Panchakarma gets its complete benefit. So as how the surgery happens with the pre-surgical procedures, then actual surgery happens, and then the patient is taken to the post-surgical ward, the same protocol is followed in every Panchakarma. So we have a preparatory phase wherein we believe that the toxins would be there in the tissues. So during the preparatory phase, the toxins that is in the tissues, we try to dislodge it and bring it to the digestive system. And during the Panchakarma procedure, it is let out of the body. So when the body goes through these 2 phases, we believe that the body would have had a lot of stress. So we need to bring back the body to its normalcy, and that is what is called as Paschat Karma. So following these 3 stages in every Panchakarma is very important to get the complete benefits of the Panchakarma. So the 5 Panchakarmas are induced vomiting, what we call as Vamana, induced diarrhea, which is Virechana, the enemas, which is called as bastis, the Rakta Mokshana, which is the bloodletting, and Nasya, which is the nasal therapies. So now the question comes as, okay, I am healthy. Should I do a Panchakarma? Yes, doing a Panchakarma when somebody is healthy or maintaining the positive health is very, very important to maintain his positive health. Just as how when we buy anything like a car or any purchases that we do, it always comes with a brochure of the services that we need to follow. And we are so diligent that we stick on to the service dates that is mentioned, and in fact we try to pre-plan the dates for the service. So this we are doing just to maintain the life of the car that we have bought. We should consider our body also to be similar. During the present lifeline, this is very, very important when we are exposed to so much of stress. The environment is polluted, we are too much into the screens, our daily routine is disturbed. So this regular servicing to maintain the positive health in us is very, very important. So anybody can do the Panchakarma. The Panchakarma would be again decided depending on what his constitution is and what his aggravated dosha at that point of time is going to be. So this has to be assessed initially by the physician, and then only the Panchakarma has to be done, because Panchakarma is an in-depth and a very deeper treatment, because it goes to the deeper levels of the body to reset its metabolism. So always take the guidance of the Vaidya to go ahead with the Panchakarma. And as I said, anybody can do the Panchakarma, but we need to look into his health conditions and then plan the Panchakarma accordingly. So generally there is inflammation that is high in the system, the metabolism goes low, our cortisol increases, we develop insulin resistance, sedentary lifestyle. These becomes the causative factors, or these becomes the reasons why even a healthy person should do a Panchakarma. So he can manage on all these levels with the routine Panchakarma. So these days the females are very much getting affected with the endocrine imbalance. So what was previously called as PCOD got renamed as PCOS because the disease got into a syndrome like, but now the understanding of the PCOS has gone much deeper. So we can say that PCOS, rather than just affecting the ovaries, is taking a toll on all the endocrine system in the body. And this we can say is because of the stress that we are going through, because of our irregular lifestyle, no right sleeping habits, we are into the easy mode of eating, a convenient mode of eating rather, and the inflammatory index is getting high, the cortisol is raising up, the insulin resistance is raising. So it's not just the ovaries that needs to be blamed for the polycystic ovarian syndrome. It is like a collective endocrine mechanism that is going on in the body, has to be taken care of when the treatment for the PCOS is considered. So because it is like a pituitary, hypothyroid, ovarian syndrome, so addressing all these systems would be very important. And the same was translated, same is mentioned in Ayurveda classics much before this new understanding came up. So in Ayurveda, it is considered as a very deep-seated Tridoshaja imbalance, wherein all the three doshas are involved in the imbalance, and the line of treatment for this is basically try to improve the cellular metabolism, which eventually reduces the inflammatory index in the body and corrects these cycles. So when the Panchakarmas are done, they does this work of resetting the body into a proper function.